These are all the same, right? PJ, these are just copies? Okay. Afide, good morning. The Committee on Health now calls back this work session with GMH. I want to thank Peter John and your team for being here this morning. On Monday, Mr. Camacho, the committee had asked for a list of priorities that the hospital needs for us to be able to provide assistance. Specifically, we've asked for those items that are needed to address perhaps any repeat violations or citations by either Joint Commission, but more importantly by CMS. And so I thank you. We have a list in front of us this morning. If you can please explain a breakdown of this list here. I know you have nursing, professional support, IT, facility maintenance, travel nurse, nurse ladder. If you can explain how this list relates to any CMS repeat violations or CMS concerns as is listed here.
Thank you, Mr. Chair. As we had stated at our last meeting, we talked about the requirements for Joint Commission, and so with respect to CMS and Joint Commission, it's looking at the overall provision of care within the institution. So after our discussion on Monday, we went back and we spoke to the different departments that you see there, and we asked them to identify the things that are important, critical to their need to be able to make sure that we don't have any issues with regards to the infrastructure, if you will, so that we can mitigate any concerns that may arise from CMS when they come, and then also in our responses to Joint Commission that these are the things that we're moving forward on. We decided to break it out by the different divisions for ease of your review and consideration. You notice that in the there is a section there under IT. That is a separate function, but it's an all-encompassing need in the hospital with regards to the connectivity between the different areas of the hospital: clinical, the medical, the nursing, and also the administrative side, the business side. So that is there, and then we also we included two separate items. One is the travel nurses. We do have a critical shortage of nurses in many different areas, and so we've put that in there, and also recognizing that there are other needs in some of our professional support areas. And then also the nursing ladder is provided there because of the need to be able to recruit and retain. It's one thing to to try to be attractive to recruit individuals, professionals to come, especially in the nursing field, and but to retain them is also a challenge, especially when there are other entities out there that are looking for nursing staff, and both on island and off island. So you see the breakdown by the different divisions, and brings you up with a total of 83 million. And the one thing, sir, is we wanted to make sure, and we told the managers, please give us the needs that you feel that is something that you have to have so that you can do your work. And so the last thing we want is to give the appearance to the senators that this is a Christmas wish list. And so that is why, but even with that, it is still a substantial amount of investment in the hospital's infrastructure and ability to provide the care.
Thank you, Peter John. So I just wanted, did you say this was a Christmas wish list that they put together? No, it's not.
We asked them to make sure that it is not going to be looked at as such.
Okay.
Yeah.
Just by initial review, because we were just looking at it now, this is really not the or at least it's not in the level where I was looking for. I was looking for something, if you can bring it down for us to better understand it in terms of the repeat violation or repeat citations that maybe you have, that CMS and past surveys have indicated need to be addressed. We wanted to see that, and how and what is needed to make those, to correct those specific violations, right? So that's one. So I don't see that here. At least I don't understand it here. Maybe you can help me understand. The other, we have a summary listing here of the different divisions and the amounts. And so we also have, and then on the pages, you have the departments, the description of the items and the amounts. We don't. What I'm asking is to break it down to our level where we don't understand, because you're the professionals. And like for nursing, this 10.5 million, what is that? Where is that here in this listing, for us to be able to see what it is? And just to explain why I'm asking it this way, is that we would like to be able to find the resources to help you address the needs you need to correct any CMS violations. And if that violation requires a purchase of a refrigerator or a purchase of a equipment down in the cafeteria, that's what we want to see. And the level of priority, if it's level 1, level 2, that's what we want to be able to see and be able to help you with. So I don't see that here, and perhaps you can explain it, or if you like, you can provide us something else that will show us exactly that list. So that's the first one, and this total here is 83 million that this list entails. Is this 83 million separate for the 125 million modernization plan?
There are some things in here, sir, that will be part of that modernization. For example, the interventional radiology suite, the angiocath suite. Mm-hmm. We currently have one, but that machine is, serving a dual purpose, and it's also, my understanding, pretty close to the end of its life expectancy, or recommended life expectancy. So that is in here. It's a current service that we provide, and we need to make sure that we can continue to provide that as it is right now.
So this would be in addition, or you're saying about 40 million more, and that would be what the modernization plan would consist of?
It would be included in these totals, sir.
It would be included in this total?
Yeah.
Okay, Speaker, Vice Speaker, did you have anything, or Senator Lee? Yes. Before. Sure. Okay.
I think we were speaking the same thing, and when we went back to the hospital, we looked at what is the harm type, what type of harm if we don't have these particular, although small items. And we looked at 3 areas that Joint Commission as well as CMS, they will be looking at, is what type of harm will occur to our patients if we don't have this type of ability. One is the immediate harm that will cause death or loss of function. The second is delay of treatment. If there's a delay of treatment because of what we're doing, that is going to be cited. Failure to treat. So when we looked at those and we told our user level, our managers, hey, what harm, if these are going to be harmful, what is it you need so that we don't have harm when CMS comes and looks at us, and now using the Joint Commission as a roadmap. And so if you look at all the details here, these are all for our users, for those for the physicians and nurses, these are all level 1. There's some level 2, some level 3, but they're all small as they are. For example, let's just look at that AccuVein finder. Just an example, Senator. Why is that so important? Why do you need $5,000 to help to staff to have that in the emergency room? Because if some people are hard to stick, we can't find IVs. And rather than do a central line or an operation, do an IV, if we have that, we can find the vein, get the IV access, and give antibiotics right away, give what's necessary, get the, so see, if we can't even start an IV in our patients, that could cause significant harm. And so we want to put that down. We want to let you know we need that. We don't want to nickel and dime our leaders, but I mean, this needs to be looked at that level. And that's why you have the nursing put in there, the emergency room, the ICU. They all gave us, what is it that if we don't have, our patients are going to have harm, delay of treatment, or failure to treat. And this is the list that we came up with. And so it may not be useful to you, but please look at it. Please look at it.
Absolutely, Doc, and I appreciate your explanation. Yeah. And it's not that it's not useful, is that there is a, as you've said in the past, you are in crisis management for the past few years.
Yes, sir.
And so I understand that. And so what we want to do is take a look at, I mean, for example, that Acuven Finder, the $5,000, the hospital really does not have $5,000 to purchase this. We'll ask Mr. Camacho.
Your question, sir, was if it's $5,000, why haven't we been able to?
For this one item, does the hospital not have or can't find the resource to pay $5,000 for this particular, I don't know if it's equipment or a supply?
Well, sir, when you're faced with the challenges with regards to the accounts payable that we have and trying to find a vendor who will be willing to provide this, sometimes we're not able to get that, and then even just the finances to be able to make sure. And I know that Ms. Manglonia, can better explain the exact.
No, I just want to hear from Mr. Camacho first. I want to hear from Mr. Camacho. I asked him a question and said you don't have $5,000 to be able to purchase this one supply.
These are equipment that are used by the nurses, and it's not just one, sir. There are many as in the units, and we may not have. I mean, we may need more than one depending on the numbers of patients that they serve. So it's not quite as simple to say it's only $5,000. If there's a need for 10 or whatever, then so.
Okay, so that's what I'm trying to get at, Peter John, is that you put it here, and I appreciate having this, Doctor. I appreciate having this and the explanation you gave us. However, what I'm asking is you give us the priority listing, right, of what is needed right now in order for you to, as using the Joint Commission report as your guidance, is when CMS does come, what are those violations that you have now that you need to correct, that that CMS would also have the same type of concerns with. Those are what I am particularly, my colleagues may have other questions and issues, but that's what I want, because in order for us to be able to help you to identify the resources right now, we need that type of guidance from you.
Okay, and I understand your question, sir. And with regards to the requirements of Joint Commission and even CMS, the conditions of participation, the standards by these two accrediting organizations, it's not just only one particular thing. It's how everything fits together.
No, I understand, but you have the Joint Commission report now, and there's specifics there, and the ones that are specifics that we've talked about was the I guess the breast milk chiller, or I don't know what it's called. That's the type of things we want to know, is that if that is a violation that Joint Commission has indicated, and you feel that CMS also has that type of violation, is that a level 1 priority that needs to be addressed today? And that's considering the limited resources we have right now. But we want to be able to find, because we don't want you to lose CMS accreditation. Mm-hmm. So that's the type of listing, and that's the question that I'm posing to you. And
I, again, sir, I understand where you're coming from and what you're trying to do with regards to, whittling it down and prioritizing what's first or foremost. And I think you heard from Dr. Dueñas, it's the overall provision of care that's going to be looked at, and it's not just going to be the repeat findings. there may be other findings if certain of these other things are not available. And so while I understand totally, and I think we all do, of you and your colleagues' desire to make sure that we address those repeat findings, there's also the concern that we need to also make sure that we don't want any other new findings to pop out because we missed something by chance. So it's not that we're being difficult, but we're trying to say, we're presenting the needs. And I think it would be not a good thing for us to only focus on the Joint Commission report citations. Again, it's the overall provision of care that needs to be done. And if it's not the AccuVein, perhaps at this point in time, but it may be something else. And so not having, all the required tools, that's, and that was the content of the letter from Mr. Pelletier.
Okay, so I'm going to ask again, on let's use the Joint Commission report. If you could, from that report, provide us, based on what you gave us today, what are those things that are indicated in that report that you have listed here that need to be corrected? Okay, and so, we'll give you time to do that, and if you can please prepare that, that's specifically what I'm requesting. Vice Speaker, do you have a question?
Yes, I would repeat that request. For example, if you're going to go down number 1 on the JCO's letter says, some security cameras for general areas and for infant care area were inoperable, therefore providing inadequate monitoring. So I would assume if you intend to address this to ensure that CMAS is not going to cite you or put your accreditation with CMAS at risk, then that is in here, and that would be,
it's part of
and that you could tie them together exactly as the senator asked, so that we can see, in order that we can take care of 9 out of 10 by doing 9 out of 10, or we would need to do 50 out of 100. How many would we actually need to pay for here, because we're looking for money, right? And so exactly how many would we need to take care of what you expect CMAS would be concerned with? And if you think you're not going to take care of something, then maybe just indicate that also, that we do not believe will be a CMAS concern, or we don't feel this is a priority to take care of now, and so that's not listed in here.
Madam Vice Chair, on the facility, you will see there that the facility maintenance, the PA upgrade system is going to cost $100,000.
Okay, is that in here?
Yes,
Yes.
yes,
Okay.
ma'am.
It is
All
here,
right.
ma'am.
Yes, ma'am.
As well as your...
I'm sorry.
So the PA,
devil is
you're
in
going to
the
have to fix the PA system to take, but that's a different item.
Yeah.
The PA system was a different item from the security cameras for the.
I don't think we have that sheet that you're looking at, Dr. Duenas. No, I just looked twice.
Yeah,
We
all
don't
of
have
our
that same
sheets
sheet.
go vertical.
I
can point to you where it's
Yeah, the other thing is, are you saying then, because you didn't submit any, that there are no CMS violations or repeat violations that need to be addressed? And it's either we are addressing JCO or priorities for each unit. And I can understand that, but I just want to make it very clear whether these are addressing JCO concerns, CMS concerns, or just the unit's concern.
Madam Chair, this addresses, we don't see any distinction between Joint Commission and CMS. We consider those, they have the same philosophy,
Okay.
same approach to patient care and patient safety. So we don't see any distinction
Okay.
at that.
So would you say then
it's
that
right here.
it's, well, I thought the premise from the last meeting was that then we would have to address all of these concerns that were listed. All right, and so do you still agree that that's the priority, is to address those concerns?
We want,
The JCO concerns then, because they're the same as CMS, you're
They will
saying?
be the same, yes, ma'am.
There are no other outstanding CMS concerns?
The last
That you've
CMS,
been-
formal CMS we had was in 2011, I believe. And I'm not clear if all those that were listed in 2011, that's the last time CMS came to GMH in a formal way to accredit GMH, and I do not recall that any outstanding elements there.
Okay, well, that sounds good.
But
If I
we'll get you that information.
may I? So, no, again, as I want to emphasize, in the 2011 survey, CMS focused on patient care issues, and I gave an example of the OR limitations. So, if we expect CMS to have the same emphasis on their survey, the delay in care, access to care, and the issues that Dr. Duane's brought up will be a concern. It's not necessarily in the findings of the Joint Commission citation, but we know that it's happening at the hospital. And with that happening at the hospital, we're concerned that CMS will find a violation.
Did you determine that we have that list for facilities? Sorry, Dr. Duenas, earlier you were reading off of a list. You said it's there for the PA system. Is that a facilities list? Or okay, so is
Vice
that
Speaker,
facilities?
I'm sorry to interrupt you. They're just making a copy of the list so we can all have
So we don't have it.
access
All
to
right.
it.
Is that facilities list? How does it compare to the facilities list or the CIP list that was submitted with the budget request? Is it the same?
These are lists that have been identified based on your requests. So there's some items in here that have been requested in the past that have not been addressed, because the first thing that we remove whenever we get the budget and there's not sufficient funds it's the CIP.
Are those indicated? Which ones overlap? Because we had asked at the last meeting that if you can indicate in this request, this priority list, which ones were already requested in the prior budget request?
Well, these are
Or are they
items
new,
that
or
have
have
not
they
been
come up?
addressed, and if you'll recall, for FY18 budget, we had to reduce it by
Right,
on
but
our
in your
side by
request,
18%.
you should have listed everything that was a priority. right,
This
for the budget?
this came from all the departments because we asked all the
So these
the
are new, and these don't
units.
necessarily overlap with the budget request
It could,
items.
I mean, like I said, these have been requested. There's some that have been requested in the past, and we just have not been able to fund.
I
And-
know.
and-
Well, we had asked that you indicate for us which ones overlap with previous budget requests, or the CIP that you had planned to take care of with the current budget.
I mean, like I said, we're going to take care of the current budget. We were cut. I mean, the submission that we submitted wasn't. I mean, the appropriation that we were given was not
Yes.
sufficient, so we had to cut 18%.
I know,
And,
so that's all we
so,
want to know
yeah.
is which ones here were also included in the list of CIP projects under your budget request? Which ones had you agreed with your budget appropriation that you were actually going to take care of under that, with that appropriation? And the rest, we are going to guess, are new requests, right? So that's all I want to know. Which ones are
Okay.
new versus which ones were on the prior budget request?
Thank you, Vice Speaker. And so I just want to focus it back, Peter John, to what specifically we were asking for is the based as a guidance, as a Joint Commission guidance, using that as a guidance, and to what CMS may be coming back with, what in each of these departments here that you've listed here, what are those priorities? And you can still keep this priorities there because this is your, but the level of priorities so that we know specifically how we're able to help you and what is needed right now, what is needed tomorrow, what is needed the next day. That's basically what we're trying to get at with you. So that's one. And so now that if we do find the resources to be able to do this, and you're able, and we can get you the tools to get these equipment, what is your procurement authority at the hospital? Are you able to do this, or what's the procedure?
the hospital has its own procurement authority, so we would do whatever depending on the procurement level. If it's below a certain amount, we can do it small purchase. If it's a bigger amount, then we would have to go through the process, whether it be an invitation for bid or through an RFP. So just depending on the level of funding that would be required.
So what's the different levels? What's considered small purchase for the hospital?
Well, with I believe it's 50,000.
It's a small purchase.
15. And with regards to even the hospital's current procurement rules and regs, anecdotally in a conversation with the Attorney General, she was suggesting that we do need to upgrade our procurement processes manual, and so that's something that is one of going to be the projects that we'll be working on. Invitation, or if there's a procurement that's over 500,000, then we have to go through the. We need to include the Attorney General in that process so that we can go ahead and, be guided by their, their direction in terms of moving forward.
Is that for services or for equipment or supplies? Or it doesn't matter if it's over
I think
500,000?
if it's over 500,000, I believe the law says that the AG must be involved.
And you
Kinda
would
like
need
the
to go
family
through a
percentage.
competitive bid process?
I'm sorry?
Also, you would have to go through a competitive
Yes,
bid
sir.
process?
But the Attorney General needs to be in the process, part of the process from the beginning to the end.
Okay. Senator?
Thank you, Mr. Chair. I just wanted to reiterate what the Vice Speaker had mentioned about anything that might overlap with previous requests. If you could highlight that for us, and things that have been identified by JACO and have been identified by, or that we might anticipate being identified by CMS, if you could highlight those for us, just so that we can, kind of elevate that on our priority list, I guess. But I just want to also reiterate what the chair just mentioned about kind of a timeline that we had requested. So we understand that all of these things that you've listed as your priority list total to $83 million, but are there other priorities, like if, all the stars align and we're able to tackle this list, what's kind of next? Or are there more immediate things that need to be handled that you're able to kind of siphon off of this list that are super, super urgent, and then our next kind of, just so that we're able to better plan and what you might identify for, the next quarter or the next year, just to be able to lay it out for us in a timeline of that fashion so we can plan and just do the best with what we are able to provide to the hospital. That's one. And then one other comment that you had made in response to the chair with regard to the AccuVein finder, he was asking, okay, this is $5,000, why are we not able to just purchase this? And then in your response, you said that there might not be a vendor that will deal with you.
If we're
Can
on
you-
credit hold,
If you're on a credit hold, there
On
might not be a
credit
vendor.
hold,
So
if
if
it's
we're
not
able
available.
to identify the $83 million and get all of that money to you, is that still going to be an issue with vendors not being able to deal with you?
we would still, remember, we said that a lot of our equipment at the hospital, is over the expected
Life.
manufacturer's
Right.
recommendation. So through that preventive maintenance program, we're still able to keep them going. But I think you'll agree that if it's a newer model, it's probably going to be more efficient, more in terms of its operations as opposed to an older model.
Right.
And so if we're able to, we'll still have the AccuVeins, as you pointed out. We're continuing to use that right now. But, to your point about planning appropriately, the dedicated funding source would allow the hospital to then better plan for those future things, exactly in line with what you said, ma'am. So thank you for that.
Right. So just going back to the AccuVein finder, when the chair asked you if there's maybe $5,000 that you might be able to identify to take care of this one item in this long list of things, your response was that you might have an issue with a vendor not being able to fulfill that request. Even if you had the $5,000, that there was an issue with the vendor. So I just wanted to
We wanted,
be clear.
if I may clarify,
Thank
because
you.
it's used throughout the hospital, so not just in one particular area, but it is used by different units as because it's for folks who have a difficult time finding veins.
That's me.
Yes.
I'm that patient that has a,
So
they might have
it
to put a
has-
PIC line, so I
Right.
understand that. But what I'm asking is, you responded by saying that even if we were to identify $5,000, that there's an issue with the vendor.
If we're current with our vendor payables, as when we were able to pay those old debts, the supplies started to be, coming in more regularly, more frequently. So we had less issues of credit holds.
Got it.
So that's what I'm saying. So now as our accounts payable has started to creep up again, there are concerns from vendors saying, I can't release this unless you pay this.
Understood. Okay, thank you.
You're welcome.
This whole list, this professional support, is that broken down anywhere? Oh, okay.
This, Mr. Chair, may I just ask, this, this facilities list is very, I can't imagine that, are these things are you being cited for things like not demolishing that MRI building out front? Is that really a health concern for patients, that that building sits out there? Because you're putting it on a priority list, and these are the things I guess I don't understand. It's $150,000 to demolish that building, and I can't see how that's harming any patient by sitting there, where we have things in here that if they're, directly related to patient care and they're not available, then I would think, that's why I guess I'm just showing that as an example, that we really do need it to be prioritized in the order of priority, I guess, to be very clear. Because right off the bat, I'm looking at that, and I'm not a doctor, but I can't see how a building sitting out beyond the parking lot is affecting any patient at this point, and why that is going to be prioritized over paying your vendors, over getting your equipment for patient care. And so please, this is not we need to know the priorities, because the money that we're going to find and give to the hospital is going to come out of other services of the government. I mean, make no mistake about that. That's where it's going to come from. So we need to know what exactly do we need to take care of our patients. That's what we really want to know.
I understand, and if I might just comment on your concern, Vice Speaker. The MRI building sits outside in the parking lot, that extra parking lot across the road. I believe there are about 12 parking spaces that are there. And so and you hear stories of our staff circling, where there are people circling to try to find parking, which includes staff. So if we were able to open up a few more slots, it might cut down on some of those delays in staff perhaps finding, some place to park so they can get onto their job shift and relieve their colleagues, or even for patients who are coming in for some services. But I understand your concern.
And Peter John, just to give a suggestion, if that's the case, that you need parking lots, I suggest you remove all the administrator parking lots in the front and reserve that for your nurses and doctors that need to get to these patients on time. So that's one. And so, we're going to end this work session now and ask you to come back or to give us a list. You don't have to come back. Give us a list by the end of close of business today that gives us that priority listing of what we're asking for in terms of the Joint Commission report and what you believe CMS is going to write up on the hospital. That's the listing that we're looking for. Okay, so, yes.
Can I just get one question? The other thing too, just following up on what the Vice Speaker was talking about, when you go down this list, you see the demolition of the MRI building up here. And down here, you have the power distribution system upgrade, okay? You forget I was the only one of anybody here that attended your hearing last summer on your upgrade. And I remember very clearly Mr. Kondo talking about the fact that the power distribution was the first thing that can and should be done. Because if you don't have the power system up, you can't put in your MRI, or if we put or at least the example that was given to me last summer was, if you put in the MRI with the power fluctuation, you blow up the MRI again like you did the last one. So why is the power distribution this far down as opposed to being at the top? Because I remember that, you guys forget I attend all these hearings and I remember these things.
You're correct, Mr. Speaker. You're correct. And as when we began our discussion, these were all of the priorities that had been identified. What was the value of that one? 2.9? Okay.
Yeah, this list came from facilities, and this is, according to facilities, these are all their top priorities, yeah. We'll just move it to the top.
But
Yeah.
that's what the Vice Speaker's
But-
asking for,
but-
and that's what I said to you guys.
Yeah.
Quit using the word priorities if you're going to give us 30 things in the list, okay?
But according to him, these are his priorities, the priorities that we're listing.
And please remember that I was attending board meetings when 12 years ago. And I attend almost any time that I get invited. And when I went up to the presentation, I attended and I listened to him give the presentation about the power system and the importance of the power system to the whole running of the hospital. And then you come to me, and it's down here, down near the third quadrant. No, it's actually almost the fourth quadrant.
Okay, so Mr. Camacho, are we clear on, at least is it understood on the exact type of list that we're looking for now? Okay, great. Mr. Kando, did you have a?
Yeah, I'd just like to make a comment, because we were talking earlier, the Vice Speaker was talking about the surveillance system. And a surveyor may come in and they may identify one camera, one monitor that's not working. But we know that the entire system is beyond its useful life, is failing. It's similar to the nurse call system that we replaced at the SNU and at the hospital this past year. A surveyor may come in and they may be on one unit and identify a few patient rooms where the nurse call system didn't work. We cannot just fix those 2 rooms. We need to fix the entire system. And that's the surveillance system, the access control system of the hospital. We're planning to replace the entire system. It doesn't make sense just because the surveyor found one little. They're not looking for the problems with the entire system. They're going to call out, okay, this part of it's failing. You got a problem. But we know what the entirety of the problem is. So that's what's on our list. If we're sharing with you a system on the list, it's because the entire system needs to be replaced. And so it's kind of hard to feed off of that report and just say, okay, they found us in these 2 areas, so we're just going to fix those, and this is the small amount. That's not what our list consists of.
Thank you, Mr. Chair. While we have you here, I received through messages and communications the GMHA Board of Trustees meeting minutes, the agenda, and the attendance sheet for December 13th, 2017. And as I was just recollecting in the JACO report and in the media, one of the issues that came up was the fact that the board did not meet because of a lack of quorum. And so I took a look at the attendance sheet, and actually on the top of the agenda it says, call meeting to order, note, 5 members establish a quorum. And then here, on the regular meeting attendance sheet, there are 5 signatures, and so it looks like the meeting did take place, that there was a quorum.
Yes,
so
ma'am.
in December.
Yes,
but
ma'am.
they said that the last meeting did not take the last meeting
No
took
meeting.
place in June or July.
Yes, ma'am. Yes,
And
ma'am.
so I just wanted maybe a clarification.
Absolutely. I'd be
If you
happy
could,
to
thank you.
When Joint Commission comes, they're going to ask for board meeting minutes.
Documentation.
Yes.
Right.
And so in that particular instance, the meeting minutes had not been completed at the time. So they didn't see minutes, actual hard copy minutes. And so, as that we've been saying, if it's not documented, it didn't happen.
Right.
So that's how strict they are with regards to, so yes, we did have a meeting, absolutely.
Right. And so this took place on December 13th. It's my understanding that there's a member of your staff, maybe like a board secretary, that's charged with putting these minutes out. And so that's one of the reasons why we got dinged on that most recent report. So it's not necessarily that we didn't meet quorum, but that we couldn't get the documentation out?
Yes,
Okay,
that was
thank
their
you.
citation. Yes.
Thank you.
You're welcome.
Yes. Okay, thank you. So staff will work with you, so we can get that this listing in order. Thank you.